It starts with something small, a dull ache, a little discomfort in the lower right side of your abdomen. You ignore it. Maybe it's something you ate. Maybe it's just gas. But within hours, that small discomfort can turn into one of the most common emergency surgeries in the world: appendix removal. Over 300,000 appendectomies are performed every year in the United States alone. It's often described as a routine procedure. Simple, fast, safe. But is it really that simple? Let's rewind. The appendix is a small, finger-shaped pouch attached to your large intestine. For decades, doctors believed it had no real purpose, a useless leftover from evolution. But more recent research suggests it may actually play a role in immune function and maintaining healthy gut bacteria. Still, when it becomes inflamed, a condition called appendicitis, it can become life-threatening. Here's what happens. When the appendix becomes blocked by stool, infection, or swelling, bacteria begin to multiply inside it. Pressure builds, blood supply decreases, pain intensifies. If untreated, the appendix can rupture, and that's when things get dangerous. A ruptured appendix spills bacteria into the abdominal cavity, leading to peritonitis, a serious infection that can spread rapidly. This is why timing matters. Early appendicitis is often manageable, but delayed treatment increases complications dramatically. So what actually happens during the surgery? In most modern hospitals, surgeons perform a laparoscopic appendectomy. 3 small incisions, a tiny camera, specialized instruments. The surgeon isolates the inflamed appendix, seals it, removes it carefully, and cleans the area. The entire procedure often takes less than an hour. Patients usually go home within 24 hours. Sounds simple. But here's what people rarely talk about. Even routine surgeries carry risks. There can be bleeding, infection, reactions to anesthesia, injury to nearby organs, post-surgical adhesions that may cause future bowel obstruction, and in rare cases, complications escalate quickly. So who is most at risk? Young adults between 10 and 30 are the most common group affected by appendicitis. But elderly patients often face higher complication rates because symptoms may be atypical and diagnosis may be delayed. For athletes, busy professionals, and students, the audience watching this right now, the biggest risk isn't the surgery itself, it's ignoring the symptoms. Sharp pain that shifts to the lower right abdomen, fever, nausea, loss of appetite, pain that worsens with movement. Those are red flags. Now here's an interesting twist. In very early cases, some doctors are experimenting with antibiotic treatment instead of immediate surgery. In selected patients, it may work, but recurrence rates are higher, and not every case qualifies. So the gold standard remains surgical removal. The good news? When performed early, appendectomy has a very low mortality rate. Recovery is fast. Most people return to normal life within 2 to 3 weeks. The hidden risk isn't the surgery, it's delay. It's assuming it's nothing. It's waiting until the appendix ruptures. Because once it bursts, the situation changes from routine to emergency in minutes. So is appendix removal a simple surgery? Yes, when treated early. Is it a hidden risk? Absolutely, when ignored. The real danger isn't the procedure. It's underestimating how fast inflammation can turn into infection. Your body whispers before it screams. The question is, will you listen?